Okay, well, here we go. So I want to go, well, first I want to get focused real quick, so focus. So I want to go over this paper called The Effects of Dexamethasone in Hospitalized Patients with COVID-19, and this is a preliminary report. So a few days ago, we had a randomized controlled trial in that people have determined that the dexamethasone, which is a corticosteroid treatment or a steroid pharmaceutical, that there was a positive correlation with reduced mortality, or I should say there was a negative correlation with mortality for COVID-19 patients. So it was not a double-blind randomized controlled trial, but it was a randomized controlled trial. So continuing, I want to go over this particular paper because this has the data that is associated with that press release a few days ago. So going down, I'm going to show you the graphs first, just so that we can have the data, or that you can know what's happening right away. So here's the 28-day mortality in all patients. So these lines you see, as the line goes up, that means people are dying. And so that is the y-axis. On the x-axis, you have the days from that randomization. So here, for all of the participants, as you can see, with the usual care that is in red, as the days go by, more and more people are dying, and it sort of plateaus off a little bit. And so here, with usual care for all of the participants, which was over 6,400, about 28% of people ended up dying. And I'm just, looking at this paper, or looking at this graph qualitatively. And in the dexamethasone group, they also had a curve, and that curve was statistically significantly lower for all participants. And here, the expected p-value, or the likelihood that this is just chance, is less than 0.1%. So the p-value is 0.001, so very statistically significant. So this is what you heard in the news, was this one graph saying people with dexamethasone actually ended up having better 28-day mortality. Now let's look at the other groups, though, or when we divide this 6,400 patients into different groups, we can learn a lot more. So this group in graph B is people without any oxygen administered to them. So they were not getting oxygen tanks, and they were not getting any ventilation. These are just the mild cases, or I shouldn't say mild, I should say they could have theoretically been a serious case that did not require oxygen. Let's say maybe something else is getting inflamed. However, out of this group, the people who got dexamethasone were more likely to die. Possibly. So here, the p-value is just 0.14%. So there's still a 1 in 8 chance that this line you see here with the dexamethasone treatment being higher, that could just be chance. But it doesn't. We could probably look into this a little bit more, and there's a lot of variety. Biology is a noisy field, but what we can glean from this is dexamethasone does not seem to be helping the mild or people who do not need oxygen or ventilation. Okay, but if we go to the people who do need oxygen, this is also very interesting. If they just need oxygen, so that was 3,883, the p-value was 0.002, so very statistically significant. And the usual care people got up to like 28%, and then the people with dexamethasone, only 20% died after 28 days. So that is a significant difference. So that is an 8% chance difference, and if I was on oxygen, I would like to be a part of the dexamethasone group, because there's it would reduce my chances of dying from 28% down to 20%, about. I can't see the actual numbers. But this is where things get very, very important. So if someone required invasive mechanical ventilation, so they were intubated or they seriously needed, let's say they were in critical condition, the people who are just receiving usual care, 40% of them die. But people on dexamethasone, only 30% of them died. And this was very, very significant to the point where the p-value is, the p-value is less than 0.001. So this was wonderful. This is wonderful to hear. So knowing that if you are in very critical condition, perhaps utilizing steroids might be a very beneficial treatment. But if you were a mild case, maybe you do not want steroid treatment, or perhaps maybe a different steroid would end up being beneficial for the mild cases, but we don't know that for certain. So let us go to the beginning, the effects of and if you just want to end with that, we can end with that, but I'm going to go a little bit into some of the background science as we read through this paper. So, effects of dexamethasone in hospitalized patients with COVID-19, a preliminary report. And so let's go to we'll just read this. So, coronavirus disease is associated with diffuse lung damage and corticosteroids. And these are steroids that are produced by the adrenal cortex, or hence name CORT is in them, and they may modulate immune-mediated lung injury and reduce progression to respiratory failure and death. 1 second. Do you want out, Walter? So 7 minutes. Sorry about that. So immune-mediated lung. I'll just start from the beginning. So coronavirus disease is associated with diffuse lung damage and corticosteroids, which are steroids that are produced by the adrenal cortex. This may modulate immune-mediated lung injury. So this is injury that is being caused from the immune response. And so you might have heard this called the cytokine storm, although it's not just the cytokine storms. It's a plethora of things that the immune system does to try to damage what they think is an infected area. But the problem is, if too much is infected, then the immune system is also going to do a lot of damage as well. And so corticosteroids are known to modulate the immune system and reduce progression, and may reduce progression to respiratory failure and death. So the randomized evaluation of COVID-19 therapy, also in biology, we also love our acronyms. So randomized evaluation of COVID-19 therapy, or also known as recovery. Oh my gosh. This trial is randomized, controlled, open label, so not double-blind, it's open label, and adaptive and platform trial comparing a range of possible treatments with usual care in patients hospitalized with COVID-19. So we report the preliminary results for the comparison of dexamethasone 6 milligrams given once daily for up to 10 days versus usual care alone, and the primary outcome was 28-day mortality. So here are the results. 2,104 patients randomly allocated to receive dexamethasone were compared with 4,321 patients concurrently allocated to usual care, and overall 454 patients allocated dexamethasone and 1,065 patients allocated usual care died within 28 days. And so the proportional and absolute mortality rate reductions varied significantly depending on level of respiratory support and randomization. So dexamethasone reduced deaths by 1/3 in patients receiving invasive mechanical ventilation. So this is what I said earlier, a reduction from 40.7% down to 29%. And It also reduced the deaths by 1/5 in patients receiving oxygen without invasive mechanical ventilation. So, and this is the difference between 25% and 21.5%. But it did not reduce mortality in patients not receiving respiratory support at randomization. And so, in fact, people, it wasn't statistically significant, but people who did not receive respiratory support, it appears as though they had a higher mortality rate. So in patients hospitalized with COVID-19, dexamethasone reduced 28-day mortality among those receiving invasive mechanical ventilation or oxygen at randomization, but not among patients not receiving respiratory support. So let's go down to the introduction. So SARS-2, the cause of coronavirus disease, emerged in China in late 2009 as a zoonotic source. Possibly. The majority of COVID-19 infections are either asymptomatic or result in only mild disease. However, a substantial proportion of older infected individuals develop a respiratory illness requiring hospital care, which can progress to critical illness with hypoxemic respiratory failure, hypoxemic or hypoxemic respiratory failure. So let's look up what this is. Just, I assume that's when you don't have enough oxygen in the blood, but yeah, you don't have enough oxygen in your blood. So requiring prolonged ventilatory support. And so among the COVID-19 patients admitted to the UK hospitals, the case fatality rate is over 26% and is over 37% in patients requiring invasive mechanical ventilation. So in the UK, patients admitted into the UK hospitals, the case fatality rate is over 26%. Okay, that is ridiculously high. So, yeah, you do not want to be admitted into a hospital because that is a 1 in 4 chance to a 1 in 3 chance that you are going to die. So, although remdesivir has been shown to shorten the time to recovery in hospitalized patients, no therapeutic agents have been shown to reduce mortality. So, the pathophysiology of severe COVID-19 is dominated by an acute pneumotic process with extensive radiological opacity. These are the ground glass opacities that are seen in X-rays. And on autopsy, diffuse alveolar damage, inflammatory infiltrates, and microvascular thrombosis. The host immune response is thought to play a key role in the pathophysiology of organ failure in other severe viral pneumonias, such as highly pathogenic avian influenza, SARS, and pandemic and seasonal influenza. Inflammatory organ injury may occur in severe COVID-19 with a subset of patients having markedly elevated inflammatory markers, such as C-reactive protein, ferritin, and interleukins 1 and 6. So these are some of the pro-inflammatory markers. Some of these are cytokines. So several therapeutic interventions to mitigate inflammatory organ injury have been proposed in viral pneumonia, but the value of corticosteroids has been widely debated. So there was actually a period of time when people were considering that steroid treatment was actually more associated with higher mortality and more complications. And this is being said about 2 to 3 months ago when it was really big in Italy. And Italy and Iran, some people were saying, well, Iran has such a high prescription rate or administration rate of steroids that that might have been playing a role in their elevated mortality at the time. And this is when we had a lot less data and it was really hard to get information out of Iran. However, what could have caused that? Well, it could be they were administering it to everyone without considering the fact that you had some mild cases and some severe cases. So perhaps just administration of these steroid pharmaceuticals to people who did not, who were only mildly sick, that could have had a negative effect on them. And I do know that with steroid administration, very often the steroids, the timing of the steroids is very important as far as the repair mechanisms. So I believe in mice there was some experimentation that was done on the repair mechanisms of, I think it was, it might have been muscle tissue or tendon tissue. Either way, they damaged, I'll call it the tendon, but it might not have been the tendon. They damaged the tendon, and then the administration of steroids could either hurt the fixing of the tendon or could greatly improve the fixing of the tendon depending on the administration. So if the steroids were given too early, it actually made it much more difficult for the tendon to heal properly, and it ended up being weaker. However, if you waited a little bit and then administered the steroid, then the tendon actually became much stronger as a result. So there was a modulation of the immune system. Presumably, it would be immune related, but that administration of the steroids later is what actually helped the mice repair itself. So you could have a similar situation that is happening in people with the ARDS, the acute respiratory distress syndrome, is that you don't want to give it early because that might be when you need your immune system to ramp up. But later, when you're trying to not die and you're trying to ramp down your immune response, maybe that is a better time to administer steroids. So very, very interesting stuff. So in the absence of reliable evidence from large-scale randomized clinical trials, there is great uncertainty about the effectiveness of corticosteroids in COVID-19. Prior to recovery, many COVID-19 treatment guidelines stated that corticosteroids were either contraindicated or not recommended. Although in China, corticosteroids are recommended in severe cases. So this is something that I've been a little bit irritated at Western medicine for a few weeks, because China has been doing a lot of really brilliant and really good data collection and reporting on it, and yet the West is woefully behind. So China has their crap together, and the West is hobbling along, and it's really irritating me because China fixed their problem. So I was extremely critical of them earlier, but now they are doing an excellent job now. So they're actually, you know, it's amazing when you actually listen to the scientists and doctors, all of a sudden things start going better. Regardless, practice has varied widely across the world, and in some series, as many as 50% of cases were treated with corticosteroids. Here we report the results of a randomized controlled trial of dexamethasone in patients hospitalized with COVID-19. So here are the methods, randomization, and should we go through this? You know what I am not? What I'm going to do is go over what is dexamethasone. So dexamethasone, as I said earlier, is a steroid treatment, or it's a steroid pharmaceutical. So you might be familiar with other steroids like testosterone and cholesterol. I don't know if that's technically a steroid yet, but they're all derived from cholesterol. So here, this is the chemical structure of dexamethasone, and this is a two-dimensional projection, and this is more of the three-dimensional projection, but as you can see, it is a very flat, and by proxy, it's also a very stiff molecule. And this is dexamethasone, but not just dexamethasone. A lot of steroids, or all steroids, have this general structure. So dexamethasone is a type of corticosteroid medication. So if we go to corticosteroids, these are steroid hormones that are produced in the adrenal cortex of vertebrates. So as you can see here, look at this chemical structure, which is a corticosteroid, and this chemical structure which is dexamethasone. Pretty darn similar. It looks like there's an additional double bond here, and then one of the hydrogens has been replaced with the fluorine. So yeah, it's a very similar. And corticosteroids are a subclass of steroid hormones. So here we have estradiol, which is one of the estrogens, and the reason why a lot of estrogens are the way they are is because they have an aromatic ring over here. So this is an aromatic ring. So if you've heard of how people, bodybuilders and physique trainers, if they wanted to increase their levels of testosterone, frequently they will take what are referred to as aromatase inhibitors, because this is an aromatic ring, and testosterone, let's see, let me get testosterone up. So here's testosterone, and here this does not have the aromatic ring, it just has one double bond here, whereas in estradiol, you have this aromatic ring. So you have basically a ring of these double bonds, which ends up being, they end up being, what would the word be, able to go in between multiple, how to phrase that? That's very hard to explain. Basically, these aren't double bonds and single bonds, it's actually all 1.5 bond, and you have the circle of these 1.5 bonds. Whereas in testosterone, you do not have that. So bodybuilders will take aromatase inhibitors, which prevent the testosterone, or prevent the more androgenic type of steroids. It prevents those from aromatizing into the more feminine or feminizing hormones that are aromatized. So that's why we take aromatase inhibitors. Regardless, all of these molecules that are steroids, they play a very important role in cellular signaling, and one of the reasons why is because this is a big carbon, very fatty molecule, and so it is able to get in through the cellular membranes, because your cellular membranes have a thick fatty layer, and then this prevents a lot of polar and things that dissolve in water. It prevents a lot of those from absorbing easily or getting through very easily. So what the importance of these steroid hormones is that since these in of themselves are fatty, they are able to penetrate through the cell membrane very easily, penetrate through all membranes really easily, and then it can interact with some of the proteins that are within the cell. And by doing that, it can affect DNA expression that way. So these steroid hormones are really important, and by proxy, we have developed pharmaceuticals that will emulate what some of these hormones do. So they can either block some of the hormones, or they can imitate some of the hormones. They can actually be better at doing some of the things that these other hormones are doing. In fact, all of these hormones that you have are very promiscuous in that they interact with a lot of different proteins inside the body. And so every singular steroid is going to have some leakiness as far as what effect it has on the body. But when we develop these pharmaceuticals, we can make these steroids that are very specific and target very specific proteins. And we are able to do that because we just try out a whole bunch of stuff and we see which one ends up working and which one doesn't. And then when we develop these more precise pharmaceuticals, then we can see if it has a clinically relevant effect in trials down the road. So regardless, dexamethasone is one of those, and it exhibits its effects on the corticosteroid receptors. So I don't know if I should go into too much detail. We'll just go over the anti-inflammatory aspect, and there are other possible benefits of dexamethasone, but let's just focus on the anti-inflammatory. So it's used to treat many inflammatory and autoimmune conditions such as rheumatoid arthritis and bronchospasm, which is a sudden constriction of the muscles and the walls of the bronchioles. Oh, interesting. So idiopathic thrombocytopenic Purpura, and idiopathic, I believe, means that you don't know the cause of it. And it's a type of thrombocytopenic purpura defined as isolated low platelet count with normal bone marrow in the absence of other causes of low platelets. So it causes characteristic red or purple, like little spots, it looks like. So the use of dexamethasone seems to be one of the things to do that. So it responds to, and which is a decrease in the number of platelets due to an immune problem, and responds to 40 milligrams daily for 4 days, and it may be administered in 14-day cycles. It is unclear whether dexamethasone in this condition is significantly better than other glucocorticoids. So remember, there's actually a laundry list of different glucocorticoids that we can give to people, and dexamethasone is just one of them. So it is also given in small amounts before and or after some forms of dental surgery, such as an extraction of the wisdom teeth, an operation which often leaves the patient with puffy, swollen cheeks. So, it can be injected into the heel when treating plantar fasciitis, sometimes in conjunction with this other steroid hormone, so triamcinolone acetonide. Yeah, regardless. You know what, these are just going over different things. It's not really going over the mechanism. So what I will just say is that some of the corticosteroids, such as cortisol and cortisone, these are stress hormones. And these stress hormones, cortisol and cortisone, they are released in response to stress. And dexamethasone is imitating these corticosteroids because, how to phrase that, these stress hormones actually suppress the immune system, because sometimes it is good, sometimes it is important to suppress the immune system. So sometimes we want the immune system to be strong when you have, say, an acute infection and you need to really kill that thing right away. And sometimes we want the response to be dampened so that we allow the body to heal itself. So with that, I think I'm just going to hang this up, because that is pretty much all I can really say. I'm not an expert. I think maybe in the future I'll do a paper on how corticosteroids work. I actually, a long time ago, did a presentation for one of my classes on glucocorticoids, so it might be a good refresher to go over that and turn that into a video. So with that, thanks for watching, and hopefully I will see you tomorrow.